Is circumcision healthy? Circumcision, the cutting off of the male prepuce, or foreskin, was started for religious reasons. It is traditionally done soon after birth, but in some cultures it is done to older children or teens. It is said by some to be an improvement to health, while others argue instead that it is a harmful practice. So, is it good or bad to cut off the prepuce? What is the purpose of this tissue anyway, and are there really any health reasons for leaving it intact at birth? What are the claimed health benefits of cutting off the prepuce, and is there any merit to them? All of the studies and other sources cited will be listed in the video's description. The foreskin is far more than a little flap of skin. The prepuce is actually a double-layered roll of tissue with multiple functions. It has not only external skin, but mucosal tissue, specialized nerve endings, muscle tissue, and immune cells. When unfolded, this part of the penis has about 10 to 14 square inches in surface area on the average adult. It helps to accommodate for the increase in size with erection, because as it unfolds and retracts during erection, some of it becomes part of the length of the shaft. Some circumcised men complain of painful or tight erections because this function is missing. The prepuce contains a sheath of smooth muscle called the peripenic muscle. This is arranged in a whorl pattern at the end of the foreskin, causing it to appear ribbed. This area is known by some as the ridged band, and between these ridges are fine-touch nerve endings called Meissner's corpuscles. They are very sensitive, similar to the nerves in our fingertips. As the foreskin covers and uncovers the glands during intercourse, this muscle sheath across the ridged band stretches and relaxes, causing the Meissner's corpuscle nerves within the foreskin to be stretched and therefore stimulated. A study in 2007 found this part at the end of the foreskin, the orifice rim, to be one of the two areas on the penis most sensitive to light touch, able to distinguish less than 0.2 grams of pressure applied by tactile monofilaments. Circumcision removes this tissue completely. The other area identified in this study as most sensitive to light touch is the frenular delta. The frenulum is a highly innervated, stretchy band of connective tissue that tethers the foreskin down to the underside of the penis, similar in structure to the frenulum under your tongue. The frenulum is often completely or partially cut off in circumcision. Circumcised men who participated in the same study could only distinguish pressure less than 0.2 grams along the scar where the frenulum had been attached to the rest of the penis. This is a very small area compared to the orifice rim and the frenular area of the prepuce. Removing these structures removes a lot of the sensory capacity of the penis. Circumcision also changes what was designed to be an internal structure into an external one. The frenulum and the glands of the penis are meant to be in a moist internal environment, protected by the foreskin, just like the female gland's clitoris is. On a circumcised man, there is sometimes a change in the color and texture of the skin on the penis near the circumcision scar, because this part of the penis was never meant to be external skin. Indeed, the skin on the head of a circumcised penis is really just a dried mucosal layer, but being uncovered because the foreskin is removed causes this soft, sensitive tissue to become dried, calloused, and therefore desensitized. To see this effect, we simply need to look at the difference in texture alone between the head of a circumcised penis and an intact one. The prepuce not only contributes to sexual satisfaction with the nerves it contains and by keeping the structures under it moist, but it also helps to stimulate the rest of the penis, particularly the coronal ridge at the base of the glands, by moving onto and off of it during intercourse. Men were designed to have this moving prepuce working as a unit with the rest of the penis. Many say that the foreskin makes intercourse more comfortable for women by keeping lubrication inside the vaginal canal more effectively and by reducing friction. The mucosal surface of the foreskin has immunological properties as well. It has apocrine glands, which secrete proteins that maintain proper pH balance and also fight pathogens. Lysozyme, which is also found in tears and breast milk, destroys bacterial cell walls, for instance. The prepuce of the penis has a protective function for children. It protects the delicate glands and urinary meatus from ammonia and feces while in diapers, as well as abrasions and other trauma. The foreskin has a couple other properties we don't fully understand the reason for yet, but they probably have to do with sex. The apocrine glands secrete pheromones. The foreskin has receptors for estrogen too. The prepuce is actually so important that there are circumcised men today who are going to great lengths to get some of its functions back. There is a movement called foreskin restoration and regeneration, where men use stretching and taping methods to gradually grow out the skin from the shaft of the penis to become a structure similar to a foreskin. Although many of the structures, such as the ridged band and frenulum, cannot be recreated, the protective benefits of the foreskin can be restored, and men who have been successful with this process report greater penile sensitivity because the penile mucosal tissue returns to its natural form. Painful erections due to tight skin are also alleviated because of the increased mobility of the skin. Even though the foreskin is undeniably important for sexual and urinary health, some claim that its presence increases the risk for medical problems. Is there any validity in this claim? Let's look at each health reason people give in favor of circumcision. Penile cancer. This one sounds scary. It mostly affects men in their 60s and 70s. With early detection, the prognosis is good. It is also incredibly rare, 1 in 100,000 per year rare. An intact man actually has a higher risk of getting breast cancer than penile cancer. Removing part of the penis at birth as a cancer prevention makes no sense. It doesn't completely remove the risk either. Cut men can still get penile cancer. Prostate cancer. A couple of research groups claimed to find that circumcised men had a lower incidence of prostate cancer, but these researchers were only able to find a slight correlation, and they did so by making some big assumptions. Other studies have been done that found no correlation at all. In fact, one study found a larger reduction in prostate cancer can be achieved by not eating grilled meat. One study on prostate cancer tested men for PSA, an antigen in the blood that indicates likely prostate cancer, and found that circumcision status had no association with the presence of this antigen. Also, in countries such as Denmark, where circumcision is very rare, there is not a higher incidence of prostate cancer. We would expect to see more prostate cancer there if the foreskin was causing it. The American Cancer Society does not recommend circumcision as a means to prevent any type of cancer. UTI. Preventing urinary tract infections is a common reason parents give for circumcising babies. The evidence that a circumcision can prevent UTIs is shaky at best, but even if we take it as the truth, we would need to perform 111 circumcisions just to prevent one UTI. Urinary tract infections are rare among males to begin with. Less than 2% of intact baby boys will even get a UTI. The ones who do can be treated with and respond well to the same oral antibiotics that are used to treat baby girls with UTIs. For young men, the incidence is even more rare, less than 10 in 10,000. Now, in men older than 65 years, this risk has been shown to increase to 20 to 50%, but this is not because of the foreskin, it's because of prostate changes which happen commonly in older adults. For perspective, a whopping 50 to 60% of women will experience a UTI. The risk of a urinary infection stays significantly higher in females than males throughout all age groups. But women aren't exactly dropping dead left and right from them. A urinary infection is almost always easily treated with oral antibiotics. Paraphimosis. This is an uncommon condition that occurs if the foreskin is retracted and left that way for an extended period of time, so that the lymphatic vessels inside of it are not allowed to drain and it swells. It is easily prevented just by ensuring that the foreskin has returned to its natural position after retracting. If paraphimosis does happen, it can be corrected by simple procedures in the emergency room. Very rarely does paraphimosis result in the need for surgical intervention. Phimosis. This is the diagnosis people are usually talking about when they say, I know a guy who had to be circumcised as an older child or adult because of a tight foreskin. Phimosis is the inability to retract the adult foreskin. If an adult is circumcised because of phimosis, this is actually an unnecessary surgery because the problem could have been corrected with gradual stretching or steroid cream as opposed to amputation. Phimosis can only be diagnosed in adults because it is healthy for a child's foreskin to still be tightly fused down. So if a child is circumcised because of phimosis, this is also an unnecessary surgery because there was nothing wrong with his penis to begin with. Some people, even some doctors, do not know that it is normal and healthy for a child's foreskin to be fused down to the head of his penis until it becomes retractable on its own. This can happen during early childhood or well into the teen years. It varies greatly, but the average is about 10 years of age. It's supposed to be a slow and gradual process. No intervention is required by parents or doctors to make the process happen faster. In fact, such attempts are painful for the child and can cause injury. This type of injury is called an iatrogenic injury. That is, it's an injury that is caused by a medical professional interfering where no treatment was ever necessary. This can have devastating repercussions. When the prepuce is forcefully retracted before it is ready, it will try to readhere to the glands of the penis, but will do so with scar tissue. This injury happening over and over again because of well-meaning but misinformed caregivers can actually cause infection because it creates microtears in the skin, which are portals for bacteria and viruses. Scarring from repeated retraction in childhood can lead to phimosis in adulthood. Yes, ironically, parents and medical professionals alike are contributing to the problem later in life that they mistakenly think is an issue needing correction in childhood. Some people think that the foreskin needs to be cleaned under, but all that is necessary to clean a baby's penis is to wipe it from base to tip during diaper changes. No need to pull back on the foreskin because it actually acts as a sphincter protecting his urinary tract from stool. It's designed to keep itself clean on the inside, and it does so best if we leave it alone. Generations of American doctors have simply been misinformed about proper care of the intact penis because we have been demonizing intact penises for generations in the USA. Sexually transmitted diseases. As far back as the Victorian era, people in the US have been claiming that circumcision reduces risk of venereal disease. The truth is that there is no convincing evidence that it does. In fact, there is quite a bit of evidence that the foreskin is a protective factor against these diseases. The most talked about sexually transmitted diseases in the circumcision debate are HPV, HIV and AIDS, and herpes. This is because some studies have shown a slight correlation between men having an intact foreskin and higher incidence of these diseases. For instance, 3 studies in Africa in 2005 and 2007 found a 1.3% absolute risk reduction for HIV. Only 1.3%. These African studies also had some serious flaws that could have easily skewed that number, by the way. But for every study with results like this, there are multiple studies which used better methods and analysis that show either no correlation at all or that circumcised men have an even greater chance of getting an STD than intact men do. Studies and trials have not been able to prove that circumcision prevents sexually transmitted infections. In countries in Europe where circumcision is rare, the rates of sexually transmitted diseases are much lower than in the US anyway. In the US, gonorrhea is 20 times more common, and chlamydia is 45 times more common than the prevalence found in Europe. Circumcision doesn't seem to be helping us fight STDs at all. Even if removing the prepuce could reduce the risk of venereal disease, it would not make sense to do it to infants because infants do not have sex. They will one day make their own decisions about how to prevent disease, and may choose a less invasive, more reliable measure, such as using condoms and other safe sex practices. There are immediate health risks to infant circumcision, including dangerous blood loss that can lead to shock, brain injury, and even death, infection to the wound, including the possibility of MRSA, and breastfeeding difficulties due to inadequate or no pain control during wound healing. There is evidence from numerous studies that the pain a baby experiences after a circumcision can interrupt breastfeeding. Other health risks include the possibility of the procedure being botched and needing further procedures to be repaired, and meatal stenosis, which can sometimes cause painful urination and affects 9 to 20%, that is to say, up to 1 in 5 circumcised males. This is, however, very rare among intact men. Circumcision changes the form and function of the penis. It is not medically recommended and is not a reasonable preventative treatment for any disease. Circumcision also carries serious risks. I implore parents and medical professionals to rethink this damaging tradition.